introducing me, and thank you for inviting me today. I'm Paola. I'm the Head of Alliance Strategy and Engagement at Health Data Research UK. So really good to open this meeting, but very much looking forward to hearing all of the talks and the discussions as well. So today I'm going to talk to you about some of the work that we've been doing that is relevant to diversity within data. And this is on behalf of the chairs of an Alliance special interest group on this topic, who are Kamlesh Kunti and Ashley Akbari. And as I am based in the HDR UK central team, I also would like to introduce you a little bit to my organization, because I believe today there are a lot of people from different countries as well. And so some of you might not be familiar to what we do in our work. So I'll try to put everything a little bit into context and then focus on diversity specifically. So first of all, what is Health Data Research UK? So we are the UK Institute for Health Data Science. We are an independent charity organization that is supported by public funders, and you see some of the logos here who are our supporters. We have some programs that are funded also by external and non-UK funders, such as the Bill and Melinda Gates Foundation for specific projects. And we were set up initially in 2018, and we're now entering a second phase for the organization after being renewed for a second time. Our work spans across academia, healthcare, industry, and charities, and we work very closely with patients and the public as well. So this is our mission, which is to unite the UK health data assets to enable discoveries that improve people's lives. And we have a 20-year vision, which is for large-scale data and advanced analytics to really benefit patients and ultimately to enhance public health. So quite a big mission, and grateful to be working with a lot of organizations from across the UK and beyond. So this is just a snapshot of our community that you see there. And we have, as I said, a central team that's based in London, in England, but we do have many sites from across the different devolved nations of the UK. Grateful to HDR UK Midlands, one of the regions, and for organising this event today, but we have many regions who are supporting this work as well. We also have some training locations, and we support some masters and PhD students throughout. And we also have health data research hubs, which are entities or kind of partnerships between industry and academia. And they might be thematic and working on specific data as well. So what are we about? So our idea is really that we want to support UK stakeholders, creating an infrastructure that can accelerate the researcher journey towards trustworthy use of data for the public benefit. So we aim to work at different levels. So we want to facilitate findability of data, accessibility of data. We want to enable data linkage and curation of data so that the data is usable. And we want to enable analysis and creating insights for researchers. So we do that with a lot of stakeholders and key players from the ecosystem, and to boost ultimately UK science. And we provide leadership to fix difficult technical problems and infrastructure problems. And then we accelerate and streamline health data science by collaborating with the right relevant people as well. We are working primarily in the UK, but we have an eye internationally, and we want to obviously ultimately benefit patients beyond the UK as well. So for the purpose of today as well, we have a strong commitment to diversity and inclusion, and we have a strategy for the organization. And as you see in this little graph here, basically our strategy is really looking at how we can embed diversity and inclusion for data, which means that we want to make sure that data is representative of the population that you want to study in research. Diversity of perspective for us is particularly important because we want to listen to diverse perspective and engage as much as possible with people we normally wouldn't engage. And then we look at training and the skill development aspect as well. So we need to make sure that we embed diverse skills and background in people as well. And finally, being an organization and from an employee point of view, we want to build a diverse workforce as well. So I'm going to give you a couple of examples of how HDR UK has been supporting some of the diversity projects and how we are actually embedding it in our infrastructure projects specifically. And I'll mention probably the Black Internship Program, which is something that I know also the HDR Midlands actually have been involved in from the inception. And also wanted to talk a little bit and touch on the public engagement and how we are looking to reach out to those people who are not, let's say they are underserved and that we haven't reached out to as much. But finally, I will focus mostly on the work of the UK Health Data Research Alliance to focus a little bit on this data aspect and see how we can ensure there is representative data that can be used for research. So very, very quickly, how we are tackling underrepresentation is really supporting a program of work, which is the Black Internship Program, to fill in the gap that we notice about having not enough Black scientists in data science. So what we've been doing in the past 2.5, 3 years is supporting interns from across the UK who can really be working at specific organizations from the UK. Those organizations might be within our partnership of the Alliance, but might be also beyond. And to date, we have supported 222 interns. 60% of these interns were women, which is a good thing to see already as a start. And some of them, 62% of our interns, did not attend the Russell Group University, which is also a good thing to see how it develops. And then also we noticed that some of the students were returning in different cohorts as well at different career stages. So for those who have not heard of these, probably from different countries, it's just to say that this program in particular has been very, very successful. And I believe that both from an intern point of view, but also the host organization point of view, there has been quite a lot of appreciation of how we can really support students grow in their career. And just to say that many of the students who have participated in these projects, they also have gone on and they have progressed in their career because they might have found a specific role or jobs in different areas, or they have done other internships or joined specific PhD programs, etc. So that's been quite useful to see as well. On the public engagement and involvement strategy, so one of the things to mention that is HDA UK really believes in embedding the patient voice and public voice in the strategy of the organization itself. So we also have a public advisory board, for instance, that inputs on the strategy of the organization. But one of the things that we've been trying to do in the past few months, and that's been a little bit of a pilot, is embedding a little bit different activities in our public engagement strategy in particular, because we wanted to try and reach underrepresented communities. And so, for instance, we had trialed participation at Science Festival, where we wanted to reach out to families and young children as well, and talk about data and talk about science, and started to engage with those who have not really been engaged before. We have been doing community involvement, and we've been working with also organizations who have similar aims and goals to ours from across the UK. And I'm mentioning a couple of them there. For instance, the Ethnic Minority Research Inclusion, MRI, is one of the initiatives as well that we want to work on a little bit more closely. So this was just to give you a little bit an idea of what we've been doing. And just to finish on the public and patient aspect, I just wanted to mention that one of the other initiatives is really looking at how we can listen more, I would say. So we're trying to look at giving a space to those people who might not feel very confident in speaking, or considering that diversity is not always visible. And we want to really engage with the members of the public, that they have really many different walks of life, as we say. But just to mention that that is also something that we're trying to do. So this was a little bit the general organization focus on how we want to embed diversity in our work. But one of the things that we've been doing is looking at leveraging our partnerships and our, let's say, collaborators to see how we can really embed diversity within data. And so we're doing this with the Alliance. The Alliance is a partnership or a network of data custodians and research organizations who are really committed to develop best practice for the better and ethical use of UK health data. It is convened by HDA UK, but is made up by organizations from the UK, and we really give voice to them to tell us what the priorities for work should be. So this is just to say that we have more than 90 members to date, and they are quite diverse in terms of the type of organizations. We have hospital trust, we have investments, different programs, we have public health agencies who have data that can be made accessible and available, charities, industry trade association, patients groups. And all of them are really trying to come together to shape policy so that things can change for having a better infrastructure for supporting use of data. Ultimately, we want to demonstrate trustworthiness in the use of data and also a development and adoption of specific standards for using data. And that's where also standards for data collections come in. So what do we do? I would say these are the three main things that the Alliance do. In particular, first of all, we build communities. And so we try to convene, coordinate, and drive alignment. We shape standards. And so that means that we either co-develop standards with the experts and organizations, or we agree on best practice that might be already out there. But also we want to support adoption of best practice. And so we work with those organizations to actually embed some of the recommendations that we produce. And so to reduce complexity and to drive production of standards and streamlining processes, we work through different work streams. So we work on the technology side, we work on the trust and transparency side and information governance. Usability of data is a key one because we look at data standards in particular, and we look at capacity building. So we work with Alliance members to produce outputs and recommendations that can then be embedded in their working practice. And so we have several streams, several working groups that we create with the Alliance, and the one that we are focusing on at the moment is the diversity within data, and in particular looking at ethnicity coding standards and ethnicity data collection. So this working group is a special interest group on ethnicity coding standards and was set up by the Alliance, I would say, during the pandemic, when it really was highlighted how the need of representative data is strong. So COVID-19 highlighted the significant ethnic inequalities in health outcomes within the minority groups, ethnic minority groups in particular. There was a lot of research around not having ethnicity data in clinical trials, lack of standardized ethnicity collection and reporting, and that was leading to kind of limited meta-analysis. So all of these things obviously were exacerbated by the COVID-19 pandemic, but inequalities do exist in different aspects, in different contexts as well. So we decided with the Alliance that we will look at how we can improve quality of ethnicity coding, how we can improve standardization of using data to help increase representativeness, and how we can use already the work that is out there. So we run several meetings and workshops where we have created community. So not only the Alliance members participated, but many researchers and people who have been already working in this space, they came together. This working group was chaired by Kamlesh Kunti from University of Leicester and Ashley Akbari from the University of Swansea. They really led the group very well, and they are now really supporting us in the next steps. And we discussed the need of harmonizing data standards and codes across the 4 nations, because we do have a 4-nation approach and focus. We looked at the role of healthcare professionals in capturing data, and we looked at awareness and trust, and how do we communicate to people why data is even needed, why do we collect data, all of that, how to communicate is particularly important. And then finally, we've been now writing a set of recommendations to improve recording of ethnicity data in particular, and we will present these to decision makers to see how we can implement some of these at the organizational level. So some of the things that we have explored were around the poor data quality. So for instance, systematic biases in data quality, the coding that was incomplete or inconsistent use of codes, and also the fact that records of patients from minority ethnic groups were less likely to be recorded consistently over time. So that was a problem that was highlighted. And then variation in data collection processes, as highlighted there in the graph. So basically that could be due to individual factors, organizational factors, or policy factors. So some of these things were the things mentioned. And then in terms of standardized coding, we have to acknowledge that there is already a standard that is available there. So for instance, in the UK and in England, we have the Office for National Statistics working on the 19 categories. And so how is this approached by the different organizations from the UK? There is no specific guidance or mandate to use one or the others and how many of the categories to use, etc. So those are the things that we were discussing in those meetings. And one thing to bear in mind is also when we need to look at how we develop standards, then we need to think about what other countries are also doing. So this is probably a bit small for the screen that you have in front of you, but it's just to say that these are the main, the top level emerging recommendations that we are suggesting, and that's something that we're writing up in a paper that hopefully will finalize, hopefully by the end of the year or beginning of next year. But basically, we are calling for better consistency in ethnicity data collection and better approaches across the 4 nations of the UK to start with. We are also recommending to approach data like standardizations and categorizations in a consistent way. We're also looking at communications and transparency, and again, the role of healthcare professionals there, but actually how do we talk to people and how can we make sure that we talk about why data is collected. And then guidance for healthcare professionals. Can we work with the NHS, for instance, to look at providing guidance that is consistent across the settings so that at least we try to have an harmonized approach. And finally, considering the data linkage value, whether you can, for instance, try for data linkage when you don't have information, and you can enrich the information you have in front of you with linkages. So those are the main recommendations that we are now trying to combine in an output from this Alliance working group. And then just to connect the dots and to acknowledge that there is a lot of work already out there. And just to mention some of the organizations who are already working on this and some of the organizations we have been interacting with. And so, for instance, understanding patient data, doing some work on Black and South Asian communities. We obviously know that the Race Disparity Unit is working on the standards for ethnicity data and with the Census 2021 now. And then Ada Lovelace Institute and Health Foundation working on digital exclusion, how we overcome that. And then obviously this is all, the priority of tackling inequalities is in the NHS long-term plan as well. And finally, just to mention the work of Standing Together initiative, which is one of the initiatives looking at the AI, where the algorithms work for everyone as well. And finally, this is a global issue. I think I mentioned a little bit before. And while in the UK, we try to strive for harmonized processes and standardization, we also want to learn from others. And just to mention that this is a problem that is out there. And so, for instance, this is just an example to say that the WHO released the largest global collection of health inequality data, but they do rely on how the countries collect this data. And there are a lot of inconsistencies, as you can imagine. An example of German research. In Germany, it is not allowed to collect specific data around ethnicity, but the researchers are calling for that at the moment. And then finally, the clinical trials aspect. How do we increase representativeness in clinical trials and participation in research? So different aspects to consider as well. And that's a piece of work from the NIH, actually. So in terms of next steps and how to get involved. So first of all, as I said, we are going to look at summarizing everything in the paper in terms of what we've done with the Alliance Special Interest Group, but also trying to work with the organizations to implement some of the recommendations proposed. And then we'll look at working with NHS organizations to think about a guidance for healthcare professional, and again, in a standardized way. And finally, working with other organizations to look at the transparency work and how can we increase and improve transparency of data collection and use. And finally, just to hear from you, if you are interested in the topic, if you're working in this space or you'd like to collaborate, we're really open to discussing and to collaborate with you. So I'll stop there. Thank you everyone for listening. I hope I am within the time, and I'll back to Fiona.